Hello, I'm Mr. Andy Chin, ENT surgeon here at Ross Hall Hospital in Glasgow. Having your tonsils removed, also known as a tonsillectomy, is a commonly performed procedure across the UK, especially for young children. If you or your child are experiencing recurring tonsillitis that is becoming increasingly difficult to manage, you may be thinking about a tonsillectomy as a permanent solution. Today, I'll be sharing some expert advice about having this procedure with reference to its many benefits. So, let's begin. What is tonsillitis? We've all heard of tonsillitis. In fact, most people have experienced it. Tonsillitis happens when your tonsils become infected. Your tonsils are part of a group of lymphoid tissues, which are glands in your neck that help fight off infection from germs that are breathed in or swallowed. You have one tonsil on each side of your mouth. Tonsillitis causes a multitude of unpleasant symptoms such as a sore throat, white or yellowish coating on your tonsils, bad breath, difficulty swallowing, and enlarged tender glands in your neck. You can feel very poorly with tonsillitis, often experiencing extreme fatigue and even a fever. Some people only experience tonsillitis once or twice in their lifetime, while others get recurring bouts of tonsillitis over the course of a year. Tonsillectomy is recommended when a person has had at least 7 episodes of tonsillitis in 1 year, 5 episodes every year for 2 years, or 3 episodes every year for 3 years. Tonsillectomy is also recommended when infections affect your quality of life, for example, not being able to enjoy your hobbies or taking time off work. Children are more likely to grow out of recurrent tonsillitis, whereas it is less likely to stop on its own without surgical treatment in adults. Some bouts of tonsillitis are viral and others are bacterial, so in some cases antibiotics won't help resolve the infection. Many people use numbing throat sprays and medications such as ibuprofen and paracetamol to manage their symptoms as the infection gets better slowly. Taking medications doesn't prevent tonsillitis happening again in the near future though. What are the risks associated with recurrent tonsillitis? If you keep having bouts of tonsillitis and do not take antibiotics, there is a chance you can develop an abscess filled with pus, also known as a quinsy, next to your tonsil. This will need to be treated in hospital because if the abscess pops, it can travel into your lungs, causing more serious health problems such as pneumonia. This is one of the reasons why having a tonsillectomy might be the best solution for your recurring tonsillitis, especially if you're uncertain about taking antibiotics too often, which can lead to antibiotic resistance. If you have recurrent tonsillitis, you should consider a tonsillectomy to prevent future infection and resistance to antibiotics. Having swollen tonsils from tonsillitis can also cause breathing difficulties, particularly in children. A child might snore and stop breathing for short periods during the night, which is known as obstructive sleep apnea. This can become dangerous, especially if it happens regularly. This is also a common reason for tonsillectomy, and often the adenoids will be removed at the same time. This operation is called an adenotonsillectomy. What happens during a tonsillectomy? The operation is performed under a general anesthetic, so you won't be awake during it. Your consultant will perform the tonsillectomy through your mouth using one of 3 techniques. They will pull your tongue forward to reveal your tonsils. The cold dissection technique involves the use of a steel instrument to peel or cut your tonsil away from the layer of muscle underneath it. The diathermy technique uses a diathermy instrument with heat to remove the tonsil and cauterize the area. The coblation technique uses an instrument with radiofrequency energy to dissolve the tonsil. Your consultant doesn't always remove all of your tonsils. They might leave a small layer to protect the throat muscles underneath, but this depends on your individual circumstances and what you need from surgery. The wounds in your mouth from surgery heal naturally without stitches. You will discuss the technique with your consultant beforehand so you feel informed and prepared. How long does a tonsillectomy take? The procedure takes up to 30 minutes, so not very long at all. What are the main benefits of surgery? The main benefit is that the surgery prevents you from getting tonsillitis in the future. You can still develop sore throats and swollen glands in your neck, but you won't struggle with recurrent viral and bacterial infections that might require you to take antibiotics. This also prevents you from struggling with bouts of intense pain and difficulty with swallowing, as well as many other unpleasant symptoms that come with the infection. Many people with recurrent tonsillitis find it interferes with their sleep, their energy levels, and even their ability to work. Having a permanent solution to the problem is one of the key benefits of surgery. How long does it take to recover from a tonsillectomy? A tonsillectomy is usually performed as a day case, but you may need to stay overnight in hospital depending on your individual needs. You'll be taken from the operating theatre to your recovery room where you will come round from the anesthesia under close supervision. After this, you'll be taken to your own room where you can rest and recuperate comfortably until we feel you're ready to go home. If you're going home on the same day as the surgery, you need to have someone collect you from hospital and drive you home because you'll be recovering from the general anesthesia and feel generally quite tired and groggy. Soon after surgery, your throat, ears, or even both will feel sore and your jaw might be stiff and difficult to move. This is completely normal and can be managed with traditional painkillers. This sore throat and earache can last for up to 2 weeks following surgery, but you can keep it at bay as much as possible with regular pain relief. We sometimes prescribe specialist medication for this, as well as a course of antibiotics. How long shall I stay at home after surgery? You should stay at home for around 14 days after the operation. Children should stay off school for a similar amount of time. Where possible, avoid contact with people who have colds, coughs, or other infections to protect yourself from becoming unwell so soon after surgery. You should also avoid strenuous activities during this time and take it easy as much as possible to rest and recover in the right way. Complete recovery can take 2 weeks, which isn't too long in the grand scheme of things. What can you eat after tonsillectomy? After having your tonsils removed, it's important to stick to foods that are gentle in your throat and easy to swallow. Initially, you'll want to consume mostly clear liquids and very soft foods to avoid irritating your throat. Broths, jelly, and ice cream can be soothing, safe choices. As you start to feel more comfortable and the pain in your throat alleviates, you can gradually introduce more substantial foods back into your diet. Nutrition is important for healing, so try to include foods that are nutritious yet soft, like smoothies enriched with protein powder or natural yogurt. Remember to stay hydrated with plenty of water or diluted non-acidic fruit juices as you recover. Avoid spicy, crunchy, or very hot foods as they can cause discomfort and even harm the healing tissues by forcing you to cough. We can discuss your diet in more detail following surgery. Your consultant can give you more personalized advice about what and what not to eat in the weeks following. Can you speak properly after a tonsillectomy? Due to the pain and swelling and general discomfort in your throat area, you might find it difficult to talk normally right after surgery. Most people find that their voice sounds different, either because it's slightly hoarse or quieter than usual. This is very normal and temporary. As your throat heals and the swelling decreases, your voice will quickly return to its normal tone and strength. It's important during the recovery period to rest your voice as much as possible and avoid straining it, which means speaking softly and not raising your voice or singing. If you have concerns about your voice changing, you can speak with your consultant and they can put your mind at ease. Do you swallow the scabs in your mouth from surgery? The scabs from surgery are thick and white and can sometimes cause bad breath. This is completely normal, so don't be alarmed. The scabs usually fall off a little at a time 5 to 10 days after surgery. You will swallow these slowly and usually without noticing it. So there you have it, a run through of having a tonsillectomy and the key benefits of this common procedure. If you'd like to discuss having a tonsillectomy in more detail, you can book an appointment with me or your nearest consultant at circlehealthgroup.co.uk. We hope you found this video useful and don't hesitate to leave any questions in the comments section below.